And I'm Jeff, and today we're going to be taking you to the West Penn Hospital to see how science, technology, engineering, and math is used, also known as STEM, is used in their work.
My name is Josh Franzik. I work at the STAR Center, which is the Simulation Teaching and Academic Research Center for the...
How does STEM affect the people you work with?
How does STEM affect the people I work with? It affects myself and also my co-workers directly because we participate in a number of different STEM programs with different high schools throughout the region. To name some of them, Fox Chapel, Hampton High School, Greensburg Catholic, Montour High School, and Cardinal Wuerl North Catholic. So those students actually come to the STAR Center and visit, and we go through various different programs with them while we're here, or interactions, simulations.
In about how many machines do you think you use per day?
Machines as in mannequins or...
Mannequins or your machines to operate with the mannequins, anything like that?
Oh, that can definitely vary. Just to give an example, today's a little bit slower day at the center. There would be a neonatal resuscitation course here. So they'll use a classroom, they'll do some didactic lecture teaching in the classroom, and then they're going to the simulation room where they utilize the S.T.E.M, which simulates a infant mannequin, newborn mannequin, that they will practice resuscitation on.
And about how many people do you work with actually move up to work on actual patients?
I'd say all of us at the STAR Center have worked on actual patients prior to ever getting here.
Okay, thank you very much. And welcome back to our next interview. This is with Chief CRNA Jeff Weir of the Western Pennsylvania Hospital. Our first question for you will be, how is STEM used in your work?
Well, we use science and technology quite a bit, obviously, in providing anesthesia. There's a lot of studies through science that goes into the drugs that we use and also learning the physiology of how those drugs affect the human body. And ultimately, it's the drugs that we use to put somebody to sleep and also wake them up. As far as technology goes, we just recently started using a computerized charting system here at the hospital, which has greatly enhanced our ability to give care. It has decreased the amount of time that we have to pay attention to actually writing things down because a lot of it is now automatically uploaded into a chart, so we can pay a lot closer attention to the patient while they're asleep.
How does your coworkers also use the STEM?
Well, they use it primarily in the same way that I do. The computer charting itself, again, makes their job a whole lot easier. And also through the education that we go through, the knowledge of all the drugs that we use, they go through the same education that I use. The other thing that we do for our coworkers, I know that you guys were over at the Simulation Center. Over there, we will send people over to practice certain types of emergencies that we deal with, not commonly, but that do happen, so that whenever an emergency does happen on a real patient, we've already used the Simulation Center, which is a lot of technology to practice this, and that's where you can practice it over and over and over again and get good at it, so when it happens for real, it's not like the first time you've ever had to do it.
What types of technology do you use?
Well, we use a lot of technology based on the computer system, like I said, the charting. A lot of our medications that we administer through specialized pumps, and those pumps are also technology. They're kind of mini computers that make sure that we're giving the dose at the right time and at the right amount and the correct rates. Also, when you look at our machines that we use to put somebody to sleep, those machines are all computer-based at this point. So in ventilating somebody or breathing for them, there's all different types of ways we can breathe for somebody based on how well their lungs are functioning. And all that is something that is new, I would say, within the past 10 years based on the computers.
Yeah, thank you very much.
Thanks for watching. A special thanks to Josh and Jeff Weir. But before we go, we'd like to explain how STEM in the hospital is used in Pittsburgh. Hospitals use all types of technology to keep people of Pittsburgh healthy. And once again, thanks for watching.